Welcome back. In the last episode, we explored the concept of locus of control and how it is influenced by culture, spirituality, and worldview. We discussed the difference between internal and external loci of control and how these orientations shape people's perspectives on life events. Today, we're taking this discussion a step further by focusing on the practical applications of this concept in therapy. Understanding where a client's sense of control comes from can significantly impact the course of treatment. It affects engagement, goal setting, and responsiveness to therapeutic techniques. A therapist who is culturally aware and attuned to a client's locus of control can build stronger trust, reduce resistance, and create a therapeutic approach that aligns with the client's values. So, how does this work in practice? Let's explore how understanding locus of control can help therapists develop interventions that are both culturally competent and effective. Let's get started. Research suggests that an internal locus of control is often associated with positive mental health outcomes, such as resilience, higher self-esteem, and a proactive approach to challenges. For instance, a study published in the International Journal of Mental Health and Addiction found that individuals with a more internal locus of control tend to have better general mental health. Additionally, research in the Journal of Health Psychology reported that individuals with an internal locus of control are more likely to engage in health-promoting behaviors, leading to improved well-being. You'll find the citation to the above-mentioned research in the description of this episode. These findings suggest that perceiving oneself as having control over life events can enhance resilience, self-esteem, and proactive coping strategies. Clients who believe they have control over their lives tend to take action to improve their circumstances, making them more likely to engage in goal setting and problem-solving strategies. However, this is not a universal truth. In cultures where an external locus of control is normative, it can serve as a source of strength rather than vulnerability. For example, in collectivist cultures, relying on family and community is seen as a fundamental strength. The belief that support will always be available can help develop resilience, as individuals know they are not alone in facing difficulties. In highly religious cultures, an external locus of control shaped by spiritual beliefs can bring comfort. Trusting that challenges are part of a divine plan can help individuals cope with uncertainty and adversity. Some cultures emphasize patience and acceptance over immediate action. Viewing life's challenges as part of a greater cycle can reduce anxiety and stress. Problems arise when a person's cultural perspective on control conflicts with societal expectations. For example, an individual from a collectivist background living in an individualist society might feel pressure to be more self-reliant than what they were taught. This can lead to stress, self-doubt, and even feelings of failure. A person with a strong internal locus of control in a society with structural barriers might struggle with frustration when personal effort does not yield success. A lack of external support could make them feel isolated or inadequate. This is where therapy can be an important tool for helping individuals reconcile these conflicts while respecting their worldview. Therapists should be aware that a client's perceptions of control are shaped by their cultural upbringing. A one-size-fits-all approach to therapy can lead to misunderstandings, resistance, or disengagement. For example, a therapist might encourage a client to take personal responsibility for their mental health by making independent decisions, setting individual goals, and focusing on self-improvement. However, if the client's cultural framework values external or collective control, such as relying on family guidance or divine intervention, this approach might feel invalidating or even overwhelming. Let's look at two different cases to illustrate this. Aisha is a 40-year-old woman from a Middle Eastern background. She believes that much of life is influenced by divine will and her family's decisions. She frequently uses phrases like God willing or God forbid. When facing challenges, she turns to prayer and consults her parents for advice. Aisha struggles with anxiety about her career and future, but she feels powerless to make changes because she sees herself as part of a larger plan beyond her control. A therapeutic approach may look like this. Instead of challenging Aisha's belief in divine will, the therapist integrates it into the therapeutic process. For example, they might explore how prayer and reflection can be used as tools for decision-making. To align action with faith, the therapist helps Aisha see that taking small steps toward her career goals does not contradict her faith, but can be seen as an act of trust in the bigger plan. Moreover, since Aisha values her family's input, the therapist encourages open conversations with her family, while also helping her develop a personal sense of agency. By working within Aisha's worldview rather than against it, the therapist creates a space where she feels heard and supported, making her more likely to engage in therapy. Ben is a 30-year-old man from the United States. He has always believed in hard work and personal responsibility. Recently, he has been feeling depressed after losing his job, blaming himself for not being able to find new opportunities. Ben's strong internal locus of control has become a double-edged sword. While it motivates him to take action, it also leads to self-criticism and feelings of failure when things don't go as planned. A therapeutic approach may look like this. The therapist helps Ben recognize external factors that contributed to his job loss, such as economic conditions, to ease his self-criticism. The therapist also helps Ben understand that seeking help, whether through networking, mentorship, or therapy itself, is not a sign of weakness, but a strategic way to regain control. By balancing his perspective, the therapist helps Ben learn to embrace both personal effort and external realities, allowing for more self-compassion and less pressure to succeed independently. This approach ensures that Ben remains engaged in therapy without feeling like he has failed due to forces outside his control. Understanding a client's locus of control is essential for developing a culturally sensitive approach to therapy. Here are practical takeaways for therapists. Ask open-ended questions like, who or what do you believe influences your life the most? Or when you face challenges, where do you usually turn for support? These questions help therapists understand the client's worldview without imposing assumptions. Validate the client's perspective by showing respect for the client's beliefs, even if they differ from yours. Validation builds trust, making it easier to introduce therapeutic interventions. Tailor interventions accordingly. For internal locus of control clients, focus on building self-efficacy and goal setting. For external locus of control clients, explore how faith, community, or external support can be leveraged to foster change. Address imbalances in the client's perspective. If a client has an excessive internal locus of control, help them recognize external factors to reduce self-blame. If a client has a strong external locus of control, gently introduce personal agency without dismissing their worldview. Integrate cultural awareness by recognizing how cultural narratives shape perceptions of control. Align interventions with the client's values to ensure therapy feels relevant and respectful. Thank you for joining me today as we explored the role of locus of control in therapy. We've discussed how cultural awareness and an understanding of control beliefs can shape the therapeutic process, improving engagement and outcomes. By respecting the client's worldviews and aligning interventions with their values, therapists can create a space where hope and growth feel achievable. I hope you'll join me in future episodes as we continue to expand our knowledge of cultural influences in mental health care.